It's great to see you again, Dr. Bednarski. Thank you so much for joining us today. We look forward to hearing a little bit more about your plans for survivorship. So let's start off. Tell us a little bit more about your practice.
So I am a 100% dedicated breast surgeon, so that's all that I do. And I've been doing breast care for just over 13 years. I've been in surgery for a little over 20 years. And I treat patients from biopsy through reconstruction, and I also take care of benign and malignant breast disease and deal with all of the repercussions of the things that we do to our patients. 64% of women that we diagnose this year will be stage 1, which means they have a 99% plus survival rate. And we need to be able to care for them, not just to get rid of their breast cancer, but to help them live a wonderful, long, happy, healthy life where they don't have to think about the fact that they had breast cancer.
Absolutely. Can you tell me a little bit more about how breast surgery techniques have changed over the years?
So we are really minimizing the footprint of the surgeries that we do. Unfortunately, we're not so much minimizing the footprint of the treatments, right? So we still have problems that we have a hard time getting around, whether it's from chemotherapeutics that we use, taxanes, radiation, lymph node surgery, and even just breast surgery itself. All of those things can cause a downstream side effects and causes for concern.
So you mentioned the side effects after surgery. Can you tell me a little bit more about what type of side effects you see?
Yeah, so not just the side effects of surgery, but the side effects generally of treatment. And that can be everything from psychosocial effects, these patients are so afraid of having cancer again, to their sexual activity goes down their drain, to their intimacy issues. They feel unattractive, or they are afraid of whether or not they're going to be attractive. And lymphedema is one of those side effects. And the thing that we seem to forget is that lymphedema is not just swelling, right? And it's not just swelling of the upper extremity. It's swelling of the breast, the side of the trunk, the scapula, and the arm in its entirety. It could just be swelling of the upper arm, or it could be swelling all the way down to the fingers. And then in addition to that, lymphedema also encompasses decreased range of motion and fibrosis and just generalized discomfort. And when patients have those symptoms, they immediately, it's like a light switch, they immediately think, my cancer's back.
Now, how often do your patients develop lymphedema?
When I first started out in practice, I thought that I was a really good surgeon. I really felt proud of my techniques, and I thought that I was very dedicated, and yet I was seeing lymphedema in certainly more than the 2 to 3% that we were taught of patients that have sentinel lymph node procedures will have lymphedema. And I wondered, what in the world? I think that I'm a good surgeon. Why am I having such higher rates? And I quickly realized we were only looking at the aspects of lymphedema in the arm, or potentially even just in the hand. And the reality is that we see lymphedema sometimes not at all in the upper extremity. Sometimes we'll see it just in the breast. Sometimes we'll see it in the underarm, in the trunk, on the side of the chest wall, in the scapula. And a lot of times people don't watch out for those things. So, unfortunately, the reality is that with the techniques that we have today, with all comers, everybody that we look at, we're looking at lymphedema rates over 40% for our patients. And that's, those are humbling statistics. They really should make us sit up and think, how can we help these patients?
How and when do you assess for lymphedema?
Yeah, so, I start by getting a baseline. Always get a baseline. So before we put our hands, our knife, our radiation, our chemotherapeutics on them, I like to evaluate them fully. And that means not only taking measurements, but also taking photographs, making sure that I'm taking truncal measurements, and I like to send them to a CLT or a physical therapist as early as possible. Now, the reality is that sometimes patients are really overwhelmed. And unfortunately, therapy is one of those things that sometimes gets pushed to the back. And so if that happens, then I like to at least have them get started as soon as possible after we start some sort of treatment.
So it really sounds like it's not just swelling. So what are the kind of the common complaints then that you've heard?
Yeah, so patients will rarely say my hand is swollen, or they'll rarely say my arm is swollen. What they'll say is my rings don't fit, or my bracelet no longer fits, or they'll say my breast feels heavy. They don't even notice that there's a change. They'll just feel heavy. And a lot of times it takes for me to point out to them, wow, your skin is really swollen. It's swollen to the point where it looks dimpled. Patients don't even notice that. And a lot of times that's because patients aren't even looking in the mirror. They're afraid to look in the mirror, but they feel that heaviness.
Since the NCCN guidelines changed last year in March of 2021 regarding survivorship for lymphedema, did that change anything in your practice?
So it didn't so much change anything in my practice. I'm certain that it changed for many people, because the reality is now we have backup, right? Now we can actually say to our patients, we can say to their other providers, listen, this is important and it's not just going to go away.
Certainly. That change to NCCN guidelines was a big deal for the lymphedema therapy community, and really understanding that this indication for our cancer patients to be educated, to have access to pneumatic compression, really understanding what that can look like as a tool for them. So certainly the proactiveness in that education has been really instrumental. Really, what made you integrate lymphedema into your practice?
Well, I saw it. I mean, that's really it. It was there, and patients were asking to be helped. And honestly, it seemed like other providers weren't taking care of it.
You make a really good point, and I've seen this in my career as a therapist and now working with Tactile Medical across the country, that a lot of providers say, not me. I'm not the lymphedema doctor.
Yeah.
I don't manage this, whether it's the surgeon, the radiation oncologist, the medical oncologist. It seems to be the hot potato. So kind of what's your take on that, and which one is responsible?
Everybody's responsible. We know that there is an increased risk with sentinel lymph node excision. We know that there's an even more increased risk with axillary lymph node dissection. We know that there's an increased risk with mastectomy, especially without reconstruction. We know that there's an increased risk with radiation. We know that there's an increased risk with taxane therapy. And guess what? The patients themselves come in with their own risks, right? So whether they're older, they're obese, they're diabetic, they're smokers, all of those are risk factors, and you can't blame that on any one provider.
That's a good point.
And so
they come with those.
They come with those.
On this topic, so what do you do about it? How do you treat your patients who do present with symptoms?
I do a lot of education. I make sure that they understand what lymphedema is. I actually draw pictures in the office, and then I give them booklets from different sources. Breast360.org is a fantastic resource for patients.
So we've mentioned the at-home treatment and pneumatic compression, so specifically talking about FlexiTouch. So how does a FlexiTouch work on your patients?
Yeah, so FlexiTouch works by simply going after the tiny little lymphatic vessels that are right under the skin, incredibly superficial. It's very, very similar to the type of massage that a certified lymphedema therapist would give. They're sequential pneumatic compressions, so it's from the furthest point in the extremity in towards the chest. And then the wonderful thing about FlexiTouch, the thing that I really appreciate about FlexiTouch over arm pumps is that you also have a trunk piece, a breast piece, there's a vest, there's a whole area that goes around the back, and even an abdominal piece if they need it. It's really such a well-rounded device that it's just a wonderful adjunct to everything else that we do for our patients.
Absolutely. So really just giving that patient the access to the tool, the understanding of what this can do to impact their quality of life. Myself as a lymphedema therapist, I've educated patients really on that mechanism of action that you were speaking to, how gentle it is to stimulate the surface of the skin. So really making sure that we're preserving the lymphatic fluid movement, that we're moving past those barriers created through surgical treatment or radiation, to really give our patients the absolute best outcomes. So, why do you offer this to your patients?
Once the patient has it in their home, they have it for life. And that's just a wonderful thing. The other reason that I recommend it is because it's not just go to a medical supply company, pick it up at the door, and go home and figure it out. The reality is that our FlexiTouch reps are wonderful. They actually go to the patient's home. They help to fit the patient. They make sure that the patient knows how to don and doff the garment. If down the line the patient has any issues, they know that they can call directly. If they've gained weight or lost weight, they can be refitted if that's necessary. So that's another reason why I really like to partner with FlexiTouch.
So it sounds like you really do both. You send to therapy, yes. You're a huge proponent for getting your patient into therapy early, and then this is kind of the adjunct. This is their homework, if you will. Exactly. Everybody's got some homework, and that way, they really don't have to get worse once they either are discharged from therapy or, have to take a break. They need to really treat long term.
Yeah, and the reality is that patients will find all sorts of excuses to stop going to therapy, right? And it's hard. It's very hard to think of, now I have an appointment and I need to figure out when I can fit that into my busy schedule between work and school and kids and, after school activities and having some me time. Well, the FlexiTouch actually allows them to have some me time, right?
Absolutely.
So they can put it on, they can watch TV, they can read a book, they can interact with their family, and it's just, they do it at home on their own time, and it works.
So at what point do you offer this to your patients?
So really as soon as symptoms start. I send them to a certified lymphedema therapist or a physical therapist no matter what, with or without symptoms. But FlexiTouch, I refer them as soon as they have even the smallest symptoms. I don't wait for them to get worse. I don't wait for, a certain threshold. As soon as they have symptoms, they're sent for FlexiTouch evaluation.
That's really incredible. Just hearing it as a lymphedema therapist, we often do see people who wait. Let's wait until we see more swelling or a sizable increase. So really being so proactive and those NCCN guidelines telling us when we intervene early, we can halt that disease progression. We certainly do not want it to get worse because it is chronic and progressive. What have you seen from your patients? What are your patients telling you when they do utilize this treatment?
They do a lot of confession time. So if they use it successfully and if they use it repeatedly, they definitely see really great effects. If there's a time when they don't use it or they skip a few sessions, they see the effects as well.
So what about specifically the earlier patients? So when they have pain or range of motion, perhaps just those axillary or chest symptoms, what do you hear from them about your proactive referral?
At least at the very beginning, I really like to have them use the machine daily. And they see relief very, very quickly. The nice thing is that they will see a decrease in that heaviness, they'll see a decrease in the swelling for sure, and because of the decrease in the swelling and the heaviness, they have a decrease in pain. And certainly if they're using the FlexiTouch, and again, FlexiTouch is wonderful because it stays with them forever. Right. So once they use it for a while and they prove it to themselves that it works, and maybe they do get busier and now, they can maybe use it every other day or, 4 or 5 days out of the week instead of every day, and they still see effects.
How do they get it?
Yeah, great question. So anyone can initiate a referral to FlexiTouch. So the physician, any provider, it doesn't have to be a breast surgeon, any provider can initiate the referral. The physical therapist or the certified lymphedema therapist can initiate the referral, or the patient themselves can initiate the referral.
We actually do have a new app. It's called Kylee, with a K, K-Y-L-E-E. We'll go ahead and put the QR code on the screen. But this app is really very patient-centered. It's a way for patients to learn more about the disease state, learn more about lymphedema, treatment options, what they can do about it. And it also is a way for them to track their own symptoms. So whether they're early stage or they just have a little bit of pain, tingling, numbness, numbness, or they're late stage where they have active swelling and fibrosis, they can really track those symptoms with photos and notes in the app. And then related to the FlexiTouch, have tracking information on the app. So they're working directly with that representative and getting the information on the app as far as the order. And then they can do any customer service long term. So it's really a great way to have it all in the palm of your hand, make sure that you're tracking and understanding the disease. And then we can also utilize that to share with their provider. So when you said the tell-all, they're going to come and tell you all about it. They can show you the photo, track their symptoms. So we're really excited to make sure that this is really about the patient, empowering a patient to manage their symptoms and to really make sure that they can manage them long term.
Does the app actually prompt them? Like, does it tell them these are things to watch out for?
It does.
Okay.
Yeah, there's videos, there's articles. So there's kind of several different pages in it. So I encourage you all to just take a look with the download, just learn a little bit more about it. So it could be really focused on, if you have a FlexiTouch and are utilizing it, or it could not be about that at all. It could really be about managing your own disease. Yeah. So we did talk a little bit about the initiation of the referral. What about insurance? What's your experience?
Yeah, so there's no question that insurance can be sometimes difficult, right? So different insurances have different guidelines on what they will and won't approve. And there are some insurances that we have to jump through hoops to get patients their FlexiTouch. We may have to do a stepwise pattern where they first have to go to X number of therapy sessions, or they have to have a pneumatic pump that's just for the arm initially before they actually can get the FlexiTouch. But I have to say that the more that we push and the more that we identify how important this is, I think eventually the easier it will get. And in reality, I have to say, I don't think that I've ever had an insurance company outright say no. No question. As I said, we had to jump through hoops.
You had to do your work.
Gotta do the work. But somehow or another, I really think that we've always been able to get it for our patients.
Yeah. Each insurance company does have kind of a recipe, so we know what they're looking for. They have guidelines. So making sure to be able to share those guidelines with the provider, with the therapist, making sure that you know the tactile representative in your area, because you don't want to have to worry about that piece. Really make sure that Tactile Medical can take care of that for you, understand the requirements, and make that request to the provider to be documented for insurance.
Yeah, absolutely. And as physicians, we always kind of try to push the reps out of the office, but this is one rep that you really want to partner with.
So in closing, do you have any last minute remarks?
Education is the biggest thing. So if you're a patient and you're having some of the symptoms that we discussed today, make sure that you reach out to your provider. Talk to them, ask them, are these symptoms that, could be lymphedema? It may be that your provider isn't thinking of it, and maybe you're the one that's actually going to bring it to their attention. So really, if you're a patient, just reach out. If you're a provider, you can actually take the steps as well to talk to your FlexiTouch rep. Make sure that you know who's there, who's on hand, and who can help you. Because the reality is you don't have to fight this fight alone. You can get them to help you with insurance verification, with making sure that your patient is fitted properly, and simply getting them to the right resources. And please, please make sure that you also refer them to physical therapy or a certified lymphedema therapist, because we really need to attack this from all sides to make sure that patients are really put on the right path.
All the things that we've said today, it's about access, the access to the education and access to tools. So we do have a couple of different resources. We have the Kylie app that we mentioned earlier. So please make sure to download the Kylie app just to explore, to reach out. It has the contact information for Tactile Medical, and anyone can download that app to learn a little bit more about it. We also have our website, www.tactilemedical.com. Make sure you get to know your tactile representative locally. They're going to be the one that knows your local insurances, that's going to reach out and really help your patients and be a partner in the clinic. So thank you so much, Dr. Bednarski. This was truly incredible. It was a pleasure just to hear from you and your experiences. So thank you everyone for joining us. We hope to hear from you soon.
Thank you. It was a lot of fun.